The disharmonized Shen, we have the Shen pattern. We have, almost like 12 or over 10 the patterns. Actually, that's not all. Sometimes, that's when you check the classic book, that's a lot of stuff. You can make Shen hesitation, or you can make more and more. But overall, this kind of major Shen evaluation, I think they covered the major clinical issues. Also easy, you pick out the herbs. Just follow that kind of Shen evaluation. Not so difficult. You can go to detail, totally no problem. But problem, which formula, what kind of treatment matching, a little bit hard. So we need the entire picture, certain level of the pattern, but make it comfortable. The physical pattern medicine, we have called standardization. For example, you make a liver qi stagnation. Hey, liver organ, what's wrong? Qi, what's the situation? Deficiency, stagnation. So liver qi stagnation. So that's called the standard type, the pattern name. Shen is same thing. Shen is same thing. So we try to do this way to see. Let me. So continue. We see the this kind of Shen. You see here, Shen, the property, Shen, the spiritiness. And also we're talking about the spiritlessness. So that's all the Shen evaluation. So type and the TCM treatment, we're talking in West medicine, what kind of feeling? In general, or just in general. They can be more complicated. Generalized anxiety disorder, GAD. That's like Shen irritability in different forms. Shen irritability in different forms. So this one is very, very common, GAD. Treatment, what do? We do stabilize Shen. Shen irritability, we need to stabilize Shen. So that's related to the person energy and the person Shen type. So when you're working in the clinic, what kind of strategy you want to stabilize the Shen? You want to use the points coming down, forehead, back of the head, or on the feet, descending. Or you do the certain point. You want to just do the sedating, reducing type to calm down the mind down, calm the Shen energy down. Also, you can give formula to stabilize, right? You don't want to moving when the anxiety is something, or try to trigger something. No, you just want to stabilize it, because that's the main pattern for Shen diagnosis, main pattern. Panic disorder, absolutely Shen irritability, any confusion, all can be scattering, losing control, they don't know. And hard to handle by themselves. They try to ask help, but nobody can reach. Sometimes they just feel panicky and the choking feeling, breathing trouble, heartbeat rising, and they feel fear related to death, maybe die right away. So they call 911 or call someone. When sent to hospital, nothing, everything can be normal. In our medicine, we call it Shen irritability, Shen confusion, and the Shen scattering. So we need to stabilize the Shen. We have to regulate the Shen. Also, we have to binding the Shen to make the Shen stabilized. But any panic disorder can be in different level, different situation. This patient maybe stabilize the Shen, that's enough. Maybe this patient, you have to regulate the Shen, that's enough. Or maybe this Shen, you binding the Shen, that's okay. Or maybe you do 2, 3 treatment together to handle the Shen. That's very depending on the individual, what kind of panic. So that's why in Western medicine, the talking panicky, very similar. They just give sedative or something. In our medicine, when you look at panic disorder, the energy level, related type, that can be very different. Even the physical, someone suddenly choky feeling, lung qi stagnation is major. Someone palpitation, the heat, heart fire type. Someone feel palpitations, also feel collapse, heart qi deficiency, and heart the qi stagnation. Also, someone feel entire body feel shaky, weak, exhaustion, urinate or something. Kidney qi got damaged. So everybody can be in the different situation. So in our medicine make a lot of sense. We're not just focusing on the emotion itself, no. Also we watch entire body energy reaction. Then also we have Shen diagnosis. So we know the scattered make urinary trouble. We know the Shen is like unstable, make mind goes everywhere. We have to stabilize it. We got a lot of the worries, the fears, crying, or something. Anyway, all the Shen expression, emotion, they tell us the Shen pattern, so we can do the treatment. Like phobia, agoraphobia, or social anxiety disorder. Anyway, Shen irritability, anxious, but also can be related to Shen weakness, Shen oversensitivity, that kind of situation. So not just anxiety, but also towards a certain issue. Maybe the Shen energy very weak, exhausted, hard to tolerate any stimulant, pressure, burden, hard, because Shen is weak. Or maybe the Shen is in a certain oversensitivity situation. Tiny things trigger something. Or make a lot of associated thoughts, develop certain emotions. Because our Shen energy, the patient's not harmonized. When they sit down the sharp corner, they don't feel comfortable because the sharp corner give the pressure to the chest. They feel suffering.